In this video, I'm going to talk about how to stretch your lower back, and more importantly first, how not to stretch your lower back. Hopefully by the end of this video, you'll understand why I've said what I've said, how it might apply to your back pain, and how to move forwards more effectively. So there's a lot of different stretches for the lower back, many of which aren't really applicable when you're in pain. A lot of them are generally actually okay when you're out of pain as a way of just keeping the lower back mobile. The first principle I want you to watch out for or follow is when you're not in pain, stretches in all ranges of motion are actually quite good. To limber up the joints, the ligaments, etc. in all ranges, forwards, backwards, left, right, rotations, etc. to keep a good degree of flexibility is generally a good thing. So you need to disregard that if you're actually, or disregard that principle if you're in pain. Okay, if you're in pain, you've got a lower back injury, then follow these next bits because they're very, very important. And some of these points, if you're not in pain, don't really apply. So the first one, if you've got an injury to the lower back, it's generally something to do with the lower bearing structures. We want to try and avoid excessive end of range stretches first and foremost, because those just aren't helpful. One of the big ones, if you've got a disc problem, is bending forwards to touch your toes or bringing the knees up aggressively to essentially do that and flatten that curve. We hear this from people doing things like yoga and Pilates. If you've got back pain, you don't want to invariably be flattening the curve. We see patients, tons of patients here at the clinic, many of whom, the overwhelming majority of whom have some scans of some form or other. And one thing that we do see is the majority of patients with disc-related problems in the lower back have a reduced curve. That reduced curve compresses on the discs and creates trouble. We do work extensively to restore that lordosis, but that's another video. So flattening that spine further is not helpful. So this sort of thing, leave it out. That's number one. Don't do that stretch. That's, I think, child's pose in yoga. Just leave it out. The next thing is excessive backward bending standing up. Although that can actually be helpful for the discs because it opens them out, if there's any other more complicated issues going on down here, that's not so helpful either, because that extension compression can grind on the facets and often give you a good degree of discomfort, a good degree of sharp, more local pain or radicular pain down the leg. So don't do that stretch either. What we do recommend at home and in the clinic are two things. Number one, if you're at home, check out our lumbar disc stretch, because that one is awesome. It's a nice, gentle, safe way for you at home to just take the pressure off this spine in a nice, safe and effective way for 2 to 3 minutes, and then you pop off the towel. It involves putting a towel just underneath that lower back so it supports that natural arch. Do this on the floor, works very, very nicely. Rolling the towel up about the size of a foam roller. But I do stress, check over to that video on our YouTube channel and you'll see exactly how to do it with all the instructions you need. So follow that one because it's awesome. Now, in the cases of a little bit more complicated back pain and you want to stretch that back more specifically and safely, then we use spinal decompression or IDD therapy here in the clinic. And that involves popping you on our table. Essentially, the table allows you to lie down on your back and it gently stretches and takes the pressure off these discs. It's got numerous benefits which you can watch in one of our other videos on IDD therapy, but it is a fantastic way to safely take the load off that spine. And the great thing about it is if you're in a lot of pain, you stand on the table here, the table slowly lowers for you, then the treatment will gently, and I stress gently, just take some of the pressure off those discs by just gently stretching the spine from here. And then when the treatment's finished, the table pops you all the way back up onto your feet. One of the disadvantages of other methods is that although the treatment might be good while you're lying down, you've then got to get up on your own steam. And actually the IDD table is awesome at stretching that spine effectively, safely, and in a targeted way. And in the clinic here, we combine it with other therapies, which makes it even more effective in our opinion. But doing that sort of therapy, if you've got a more severe disc injury in your lower back or just general back pain, it's a fantastic way to stretch your lower back safely, effectively, and get results and get you on the way to healing so your body can get back into rehab and ultimately dealing with the underlying causes of your lower back pain. So I hope this video has been helpful. We've got a few don'ts, a few do's, and that little bit on spinal decompression or IDD therapy at the end, which is a more involved sort of one-on-one approach to dealing with your back pain and stretching that spine effectively. Awesome as a maintenance thing, something I do a couple of times a week, and people or patients find that once they're out of back pain, if they've got a particularly desk-based office job or sat down a lot during the day, it's a nice thing to do as a sort of maintenance process. So I hope you found this video helpful. If you've got any questions, please do comment them in the section below, and make sure you subscribe to stay up to date with future videos. Thanks again.